Hey everybody, we're gonna go ahead and get started. For people I don't know, my name's Ben Trufflick. I'm one of the chiefs here at the Denver Health Ambulatory. We're gonna take a little break from cases and do what I'm calling rapid fire journal club and pub trivia. A couple objectives for this talk. So first and foremost, have fun, and I'm being serious about that. I want to introduce you to a lot of recent articles. So all the articles we're going to run through today have been at least within the past year, most of them within the past month. And then there will be QR codes on all these articles. So if anything as we're going through strikes your interest, go ahead and scan it, and it'll take you to a link to read more about it. As a disclaimer, this is not a formal journal club, and what I mean by that is we're not going to dive deep into methodology, and we're not going to dive deep into open discussions on clinical impact. We'll talk a little bit about it, but we are getting through about 14 articles in this short time, so it'll be pretty quick. Definitely feel free to chat in the comments. I have Corey and Mira on to help kind of manage the comments. And equally as important, so for the trivia, you're in teams, you have 30 seconds to answer. Private chat all your answers to Corey or Mira, and then all questions are worth 1 point. All right. Any questions before we get started? All right. So first question. Although it's the least populated of the 5 boroughs, this New York City neighborhood saw the largest influx of senior citizens from 2000 to 2010. Yeah. All right, time's up. So our team here at Denver Health got it right. It is Staten Island. So why are we talking about Staten Island and old people? Because we're talking about statins and old people. So this was a study that came out. This is a study that came out earlier this month out of the VA. It was actually, let me move this really fast. It was a study that was a retrospective cohort study from 2002 to 2016. And they looked at adults 75 years and older who did not have ASCVD or were on a statin at the age of 75. And then they excluded them if they died within 150 days. And kind of surprising, what they found is after they adjusted for comorbidities, people who were started on a statin at this age group actually had a lower risk of all-cause mortality and cardiovascular death. And this actually contradicted some prior studies that we had out of the British Medical Journal. So it's pretty big news. That's the QR code if you want to read about it. For anyone that watches or listens, I guess, to the Curbsiders, they do a journal club as well, and they measure the clinical impact of their journals by pancakes, and I'm a huge breakfast fan, so I'm going to do the same. I gave this 2 out of 3 pancakes, mostly because I don't think we're going to be starting all of our 75 and plus people on statins, but it's something to consider if you have a 75-year-old who's otherwise pretty healthy. You may not be as averse to starting them on a statin. All right, question 2. Chris Lung was a gymnast at the University of Illinois from 2004 to 2008. Another gymnast from the Midwest has a slightly more successful career, winning 4 golds and a bronze in the 2016 Summer Olympics. Who is that? Three. All right, Denver Health got it right. Simone Biles is the right answer. What's up? She was actually born in Ohio. A lot of people say she was from Texas. She was born in Ohio. So why are we talking about Simone Biles? Actually, now we're talking about Chris Lung and lung cancer screening. So earlier this month, the USPTF released a draft recommendation to expand annual lung cancer screening. This is their old recommendation, and some of the highlights that I'm going to point out is they expanded the year from 55 to 80 and down to 50 years, and then they decreased the amount of time you actually have to be smoking. This is actually pretty important. I'm going to be a future primary care doctor, so I gave this 3 pancakes, but just know that this is getting expanded. Any questions on that? All right. Question 3. In 2016, the Marine Corps infantry stated that on average, soldiers should be able to carry how many pounds for 9 miles? And your answer must be within 10 pounds. All right, we didn't get it over here at Denver Health. The answer is actually 152 pounds. They have since dialed back this recommendation because they were all getting knee replacements at the age of 40. So why are we talking about heavy backpacks? This is a study that was published in the Lancet for obesity. This is a study that's kind of crazy. They took obese patients, about 70 of them, and had them wear weighted backpacks over the span of 8 weeks to see if they would lose weight. So what they did, they randomized people to a low load, which was 1% of their weight, and a high load, which was 11%. And there's a lot of stuff on here, but essentially what they found is that the high load lost more weight. And they lost about 2% of their body fat, so not crazy amounts. And then they actually lost percent fat mass as well. So this was published about 2 weeks ago in the Lancet. I gave this one pancake. I'm not going to strap backpacks onto any of my obese patients. All right, question 4. Indonesia, the Philippines, and India are the top 3 exporters of this tropical fruit, which can be used as flakes, water, oil, or flour. This fruit became so popular that it spurred a religion in Vietnam in 1963. All right, we got it right at Denver Health. It was coconut. So why are we talking about coconut? I kid you not, I was doing this, I put this together last Thursday, and I had this exact clinical scenario come up. Patients who I did not think would be having coconut oil asked me about the health benefits of coconut oil. So what would you tell them if you had this patient come in? Would you say it tastes great and decreases your cholesterol? It tastes great and it increases your cholesterol. It shows that it can prevent cavities. It is good for your skin, but not for your arteries, or I don't know anything about coconut oil. Yeah, so we have a lot of D's. I actually probably said E when I saw this patient. I was like, I don't know. So this is a study that was published by the American Heart Association in Circulation. What they did is a meta-analysis of clinical trials related to coconut oil consumption. And what they found when they reviewed 16 articles is that coconut oil actually increases your LDL by about a factor of 11. It does increase your HDL as well. And they compared this to non-tropical vegetable oils. So there's a lot of text here, and you can't really read it, but what I'm highlighting here is the oils that they compared it to. So there's olive oil, corn oil, soybean oils, basically any non-tropical oil. And interestingly, where a lot of the perceived health benefits from a ASCVD risk standpoint come from is that the earlier studies used refined coconut oil, which only has medium chain fatty acids, and the stuff that people buy in the supermarket has mostly long chain fatty acids. So that's why they think that it's actually not as good for our heart patients as we initially thought. I gave this 2 mostly because I was able to use it right away, but as this becomes more popular, I think the use of coconut oil has increased like 600% over the past few years. Could be important to know. So what about those other things? What about skin, teeth, and hair? So they do have some studies that show that it's good at prevention and treatment of atopic dermatitis. They do show that some weak evidence that oil pulling can prevent dental caries. And for people who don't know what oil pulling is, so essentially you take like an oil slurry and swish it around in your mouth and spit it out. And the thought is that it pulls out bacteria, pulls out stains from your teeth. Most dentists don't recommend this because people will do this instead of just brushing their teeth as well. So keep brushing your teeth, but if you want to try oil pulling, it's probably not going to hurt you. There is also some data that's good for your hair. Other smaller studies have shown that there's no improvement in Alzheimer's disease, bone loss, or glycemic controls. Those were some of the other things that have been studied. Great. And I gave all these one pancakes. All right, question 5. This pharmaceutical company, headquartered in Massachusetts, went public in 2018 using the ticker symbol mRNA. Investors hope recent vaccine developments will pay off. All right, final answers. Over here, Denver Health got back on track. It is Moderna. So why are we talking about Moderna? So this was an article that was published in the New England Journal of Medicine. This is one of only 2 COVID articles I'm going to talk about. This was their phase 1 trial for their mRNA vaccine. Like I said, published last week. They looked at 45 healthy adults, 18 to 55, who received 2 vaccinations. And they basically showed that all of the participants had a seroconversion, and then there were no trial-limiting safety concerns identified. So really quick, I gave this 3 just because COVID vaccine development is fascinating to be a part of and to watch. And then I want to take a really brief detour to talk about where we stand with different vaccines. So like I said, Moderna is a genetic vaccine, an mRNA vaccine. There's another one from BioNTech, Fosun, and Pfizer, which are German, American, and Chinese companies. And then probably more well-founded, I guess, are the viral vector vaccines. These are both adenovirus vaccines. The University of Oxford and AstraZeneca, and then CanSino Bio. The CanSino Bio is actually already approved for limited use in the Chinese military. And then we have some whole virus vaccines and then protein-based vaccines as well, which I won't talk too much about. I think a big question that we probably get from patients and family members is when can we expect to see these? And these are all the dates that these companies are proposing. Granted, I would take these all with a grain of salt, especially the genetic vaccines. We don't have any current genetic vaccines on the market. So I would be shocked if these 2 and made it to market in a big way this early. And then actually hot off the press, these just published on Monday, so just 2 days ago in the Lancet, that CanSino Bio, these are both the viral vector vaccines, had their phase 2 and their combined phase 1 and 2 trials released, which you can see there. So these are going to probably start coming out pretty frequently. Just really exciting stuff, though, when you think about kind of how fast these vaccines are coming together. All right. Next question. Not to be confused with Dunder Mifflin, a different Pennsylvania company was the first to produce a modern version of this household essential in 18. All right. Well, I'll give it to them. So it was toilet paper. So this was the Scott company. Was the first group. So why are we talking about toilet paper? This is the last COVID article I have. So this is a group out of Sweden. They interviewed 900 people to try to see if they could detect any personality causes for why people were stockpiling toilet paper during the epidemic. And this is really mind-blowing stuff that they found that the traits of emotionality, which is our people who worry a lot, and people who are conscientious, who plan a lot, tended to stockpile more toilet paper. So if anyone's surprised by that, you can talk to me later. I gave this a half pancake mostly because I thought it was funny. All right, next question. This is an advertisement from 1962 for Metacortin. And in 2018, Metacortin was the 22nd most prescribed drug in the United States, but you likely recognize it by its generic. All right, time's almost up. We did not get it right over here at Denver Health. It is actually prednisone. We were really close. I do have a bonus question. What is Cinere-Usher disease? Which I'll just give you about 10 seconds, because if anyone gets this, I'll be really. All right, we'll give 5 more seconds. It's something I've never seen, pemphigus erythematosus, which is an overlap syndrome of lupus and pemphigus foliaceus. So pretty rare. I've never seen it. So why are we talking about prednisone? This was a study out of the Lancet. Oh, excuse me. This was the, I think, Annals of Internal Medicine. But essentially came out earlier this month that looked at association between oral steroid bursts and severe adverse events. They looked at 2.6 million patients who received a single steroid burst, and they looked at a population 2064, and that they defined a steroid burst as was 14 days of steroids or fewer. And they looked at GI bleeding, sepsis, and heart failure as their primary outcomes. And I want to highlight a couple of things. So the dreaded table 1, I think this is actually pretty interesting that the vast majority of these patients were extremely healthy, right? So they had a Charlson comorbidity index of 0 in the vast majority of their patients. And then the things that we're getting prescribed steroids for were contact dermatitis, acute respiratory infections. And then if you look down, family practice and internal medicine were the most common people prescribing when you combine them. Excuse me, derm was the most common, and then second was family practice and internal medicine combined. And what they found was that in the first 30 days, and remember, these are really healthy people, that the risk of GI bleeding, sepsis, and heart failure all increased, and then that effect decreased over the subsequent 30 to 90 days. Now, this is all with the caveat that these events were still fairly rare. I think they were like 23 events per 1,000 human years for GI bleeding, which was the most common, so pretty rare, but pretty interesting that they still found these negative effects and things that we think of as pretty benign, like a 5-day course of pred or something. So for that reason, I gave it 2.5 pancakes. All right, question 8. Compound, stereo, electron, acoustic, and scanning probe are all types of what? All right, it's about 8 seconds left. All right, we got it correct here at Denver Health. It is microscope. And why are we talking about microscopes? Because we're talking about microscopic hematuria. So super exciting recommendations coming out of the American Urological Association. This was published earlier this month, late May. The old recommendation, which actually I wasn't aware of, is that any patient over the age of 35 needed a cystoscopy and a CT urography. I don't know how accepted this was in practice. The new recommendation is probably what we've already been doing. So if they're low risk, sign to repeat. If they're intermediate risk, renal ultrasound and cystoscopy. And if they're high risk, CT urography and cystoscopy. And these risks are associated with things that we would think of, so smoking, age, family history of cancers, things like that. I gave it 2 just because honestly, it's a big recommendation, but I didn't know that this was a recommendation to begin with. So, all right, question 9. The 1918 flu pandemic, also known as the Spanish flu, did not start in Spain. In fact, the first cases were documented in Germany, and what U.S. sunflower? All right, time is up. We got it right over here at Denver Health. It is Kansas. It's actually a pretty fascinating story, and I can recommend a good podcast to anyone if they're interested. But the reason it's called the Spanish flu is because they were neutral in World War I, and they didn't care about morale. All the other countries had this going on, but they were worried about decreasing morale in the war, so they didn't report it or start documenting their cases as early as Spain did. And why are we talking about the Spanish flu? We're not. We're talking about the regular flu. This is a study that was published in The Lancet, I believe, and they looked at the risk of subdeltoid bursitis after influenza vaccination. There's actually on the warning when you're doing your consent, you're supposed to talk about this. I've never have. And what they did is they looked at 2.9 million vaccinated persons, and they found the attributable risk was only 7 per 1 million. So if you have a patient who's saying they always get subdeltoid bursitis, they're either the most unlucky person or they're just trying to make an excuse to not get their flu shot. So should really temper our worries about this. I gave it a 1 just because I had never seen it. All right, question 10. 2014 was a big year for Colorado. Marijuana became legal, and this car overtook the F-150 as the top-selling car in Colorado. I need the make and the model. All right, time's up. We got it over here. It's the Subaru Outback. And this is the year that they did their big remodel, and I think that's why. So why are we talking about marijuana and cars? Because JAMA released an article comparing traffic fatalities in Washington and Colorado since the recreational cannabis laws went into effect. And what they found, interestingly, that in Colorado, that there's 75 excess fatalities per year since that they directly attributed to marijuana laws. Now, how they did that is they basically took states that were similar to Colorado and made a synthetic Colorado that don't have cannabis laws to try to isolate cannabis as the only thing. Granted, there's lots of confounders here. I think this is actually kind of cool, mostly because it's Colorado, but when I think back to how I counsel my patients on marijuana use, I rarely ever bring up driving, and I'm sure a lot of people and a lot of our patients are driving while using marijuana. So it's something that I'm going to use more frequently. But like I said, a lot of confounders, but a pretty interesting study. And they didn't see a similar increased rates of fatalities in Washington state. All right, question 11. The first school of physical therapy was established at Walter Reed Army Hospital in DC following what worldly event? All right, 8 seconds. All right, our group got it. It was World War I. So why are we talking about physical therapy? Something that we see pretty frequently. This is a New England Journal of Medicine article published last week looking at physical therapy versus steroid injections for OA of the knee. That's really good. And what they found, there's a lot of words, I'm going to highlight some things, is that they looked at these WOMAC scores, which are essentially how much pain do you have doing various things. And they said at the beginning they were about the same. And then afterwards, there was a noticeable difference in both of them. But people who did physical therapy actually did much better. And then this poor chap who fainted receiving a steroid injection, he or she is now immortalized in New England Journal of Medicine. But I think for me, I gave this 2 mostly because this is something that I harp on my patients, especially in a primary care setting, is that we're going to do knee injections, that it's a temporary fix, and that we really recommend also doing physical therapy. Physical therapy is just great if you can convince your patients to do it, and this is a way that a little more ammo in our arsenal. All right, question 12. While Arizona has no 14ers, it is no strangers to mountains. Humphreys Peak, the tallest mountain in Arizona, reaches what elevation? And you must be within 500 feet. All right, the time is up. We unfortunately did not get it correct here at Denver Health. It is 12,635 feet. So if you guessed anywhere within that frame, you got it right. So why are we talking about mountains in Arizona? This is a study. I will warn you, this is a one pancake study. This was in Arizona State. They looked at hiking time trial performance in heat. And what they essentially did is they took 17 healthy people and they strapped them up to cardiac monitors. They measured all sorts of electrolytes, urine osmols, and things. And then they had them hike up this mountain on a nice regular day and then a really, really hot day. And they basically measured, tried to see if they could detect anything. They told them just prepare as you normally would for the hike, so they didn't have any guidance. And what they found is that hikers in both conditions were limited by their fluid, but in hot weather, people ran out of water, and then in moderate conditions, they just didn't drink enough. So essentially, if people are asking how much water to bring more water and drink more water while hiking, especially when it's like 100 degrees outside. Stay safe out there. And again, it's one pancake, maybe 1.5 if you're an avid hiker. Question 13. The U.S. town of Yuma, Arizona was one of many filming sites for Star Wars Return of the Jedi. In meteorological circles, it is more famous for having the highest average amount of what per year? All right, we didn't get it. We didn't get it over here at Denver Health. I had to re-look up the definition of meteorological because everyone says meteor showers. It's a study of weather. So it was actually sunshine. And why are we talking about sunshine is because this was a study regarding that. It came out in the Annals of Internal, or sorry, this was in JAMA Open Network, where they did a huge meta-analysis looking at vitamin D and calcium in the prevention of fractures. And what they did is they essentially did two meta-analysis in one. So they looked at studies that looked at vitamin D supplementation alone versus placebo. They included 11 randomized controlled trials, and they didn't see any reduced risk in any fracture. And then for vitamin D and calcium supplementation, they did include 6 trials, and they saw a 6% reduction risk in any fracture and a 16% reduced risk of a hip fracture. And these are really small reduction when we think about things like bisphosphonates, so alendronate has about 35 to 45% reduction. But I ended up giving this 2 pancakes just because we put a lot of people on vitamin D, and I think we probably don't do as good a job of screening about calcium intake as well. And so pretty low threshold if you're starting someone on vitamin D, unless they have an absolute contraindication, which I can't think of any off the top of my head, except for a very active cancer, that I would probably talk to them about their calcium intake and think about putting them on a calcium supplementation as well. Any questions on that one? All right, we went through really fast, so we're gonna get done a little bit early. This is the final question. This slippery species, Nectar americanus, has been around for much longer than the Disney villain that shares its name. All right, we did not unfortunately get it here, but it was the hookworm. So this trial is crazy. So this was in JAMA Neurology, where they looked at hookworm treatment for relapsing multiple sclerosis, an RCT and double blind. So what they did is this was a 9-month double-blind randomized controlled trial. And people were randomized to either get injected with hookworms or placebo. They were treated at the end of the 9 months. And if you remember hookworms, they're the ones that burrow through your skin, go up through your bloodstream into your lungs, and mature and travel up into your esophagus, and then you poop them out. So disgusting. And what they were looking for is decrease in relapse. And what they found was that in the hookworm group, there were slightly less relapses than the placebo group. They did note that this was not statistically significant just because there was a fairly low rate of relapses overall. And I was trying to understand why someone thought to do this. And I guess there is some kind of T-cell mediated response to hookworm infection. So this has been something that's like, there's been case control studies that when people get infected with hookworms by accident, they have less relapses of their MS. So I think I gave it 2 just because it's a really interesting, crazy study. I don't know how they got 75 people to consent, or 71 people to consent to this, but it is out there. It was not. This was in the Netherlands, I think, or some Northern European country.
I think you can buy hookworm online.
Really?
Because there's a lot of people with various autoimmune diseases who are bleeding.
Oh man. Dr. Brunkwell with the alley-oop, he said apparently you can buy hookworm online because people kind of swear by this. So. Interesting.
So they live in you and they secrete like cytokines that lead to decreased inflammation.
That is wild.
That's the only way to survive.
That is wild. I'm sorry.
It's an interesting whole.
I don't know your name. What's your name?
Karima.
Karima?
Yeah.
Karima just let us know that the thought is that hookworms can only survive in a uninflamed host. So when they infect someone, they basically modulate their host to become less inflamed. So really kind of fascinating stuff.